Systemic lupus erythematosus, or SLE. SLE is an autoimmune disease where the immune system attacks healthy tissue and cells in the body. This can cause a widespread of inflammation and tissue damage to different organs. This disease can actually affect almost any organ in the body and has. It can affect one or more, one more than the other. Common effects of this disease are on the joints, skin, brain, lungs, kidneys, heart, and blood vessels. There are 4 different types: neonatal, cutaneous, drug-induced, and systemic lupus erythematosus, SLE. SLE is the most common form of lupus. Usually, it develops in multiple organs and organ systems and are compromised due to the inflammation caused by the disease, resulting in many different problems for the body. Drug-induced lupus is very similar, has very similar symptoms as SLE. The only difference is this lupus is caused by a certain drug, usually taken over time. This type of disease is actually reversible once the medication is no longer taken. Then you have cutaneous lupus, which cutaneous meaning skin, meaning lupus that only manifests on the skin, meaning you'll only see the irritation and the inflammation of lesions on the person's skin. You also have neonatal lupus, which is a temporary lupus effect on newborns where the antibodies of the mother are passed on to the child, which causes a problem and results in the same symptoms you see of someone who has SLE or any of the other types of lupus. Pathophysiology. SLE is basically caused by the inappropriate disposal of apoptotic cells that leads to the stimulation of B and T cells, pieces of cellular material that usually are destroyed when a cell begins to self-destruct. The constant increased stimulation of these cells can cause damage to its delivery system, and therefore the antibodies begin to attack healthy cells as well because they're unable to distinguish the difference between healthy and unhealthy cells. Normally, apoptotic cells self-destruct, leaving behind no material or antigens. B and T cells are able to relax and produce at a normal rate, and antibodies don't attack healthy cells. Causes. There are no specific causes discovered at this time for lupus, SLE. Many believe it's just a combination of genetics and environmental factors. However, there are potential factors that people believe trigger those predisposed to the disease, such as sunlight, infections, and medications. Risk factors. Race, age, and gender all have been said to influence the risk of developing SLE. For race, in the US and Europe alone, the highest rates of lupus are seen among those of Hispanic, Asian, and African descent. Age-wise, most people are diagnosed with lupus between 15 and 45, although you can be diagnosed outside of that time. And as far as gender goes, 9 out of 10 people who are diagnosed with lupus are female. Symptoms of SLE are extremely varied. Some may be more permanent than others. Some are temporary, some are mild, some are severe. It just depends on the organs or the organ systems affected. Some general symptoms you'll see with someone of SLE are fatigue, fever, skin rashes or lesions, joint pain, trouble breathing, or poor circulation, all caused by the inflammation and tissue damage resulting from the disease. The uniqueness of every case of SLE makes it hard for initial diagnosis. Here are just some pictures of different symptoms you see with SLE. Discoloration in the fingers, rashes around the face, the butterfly rash is very common, mouth sores, mouth ulcers. Diagnosis. No one test can diagnose lupus. There are many different tests for that. The various tests look at specific, are dependent on the specific organs that the lupus may be affecting, depending on the patient. One major test that most will have to take is the anti-nuclear antibodies test. This test looks for the presence of a specific group of autoantibodies that can't properly distinguish the difference between self-healthy cells and the opponent cells that they should attack, causing the damage, inflammation, and pain that we see about autoimmune diseases such as SLE. 97% of lupus patients test positive for ANA. Not all positive ANA patients have lupus, though. Other tests completed might be a blood count test or a kidney liver test. Blood count tests measure the number of red blood cells and white blood cells and platelets in your hemoglobin. Results such as anemia or low white blood cell count or platelet count may indicate lupus. Problems with your kidney or liver functioning might also point to lupus. You also have your analysis testing. An increased protein level or red blood cells in the urine can indicate lupus. Chest x-rays to find any fluid or information in the lungs. Echocardiogram to see about any problems with the valves in the hearts or any portion of the heart. And they might even take biopsies, which are just small samples of different organs or in the body, just to determine how or if the lupus is even affecting those organs. They may take a biopsy from the skin, the lung, the liver, the kidney. Effects on specific organs. SLE is a very patient-specific disease. Lupus may not cause all the same issues in one patient as it does another. These issues are all caused by the inflammation and damage of the tissue that lupus brings on. There are different effects you'll see on every organ. For example, the kidneys may fail. In the brain and the central nervous system, you may see headaches, dizziness, vision problems, strokes, seizures. In blood and blood vessels, you may see blood clotting or even anemia. In the lungs, there may be problems breathing or even pneumonia. In the heart, it may lead to a heart attack or even some type of cardiovascular disease. Lupus tends to make patients more susceptible to other illnesses such as cancer, bone tissue death, miscarriages, and like I mentioned before, anemia, pneumonia, and cardiovascular diseases. Treatments. There's no cure for lupus. The goal of treatment for lupus is to prevent flare-ups, treat the symptoms that they already have, and reduce the organ damage and other problems they may have as well. The treatments are also dependent on the signs and symptoms. One patient won't need the same set of treatments or medication as another. SLE patients are given a combination of medications to help combat the problems that lupus causes on their organs. They may get medications that help to reduce the fevers, the swellings, and the headaches they feel. There are drugs that help decrease lupus flare-ups and inflammation. And there are those medications that help to suppress the immune system and decrease the effects of lupus on the body. There are also a considerable amount of things for SLE patients to do to live a healthier life. Some things include maintaining doctors' treatment plans, learning what triggers their flare-ups, regular doctor visits, reducing stress, being cautious of sunlight and photosensitivity, choosing healthier foods to eat instead of junk food, getting enough sleep, and maybe even moderate exercise. It may also help to find a support system, a group of people you can trust and go to for help. There are many support groups out there. Future research. Current SLE studies are still searching for connections in the causes of lupus other than the genetic and environmental causes. There are many clinical trials being tested right now, including some in the FDA. Some trials focusing more on testing new drugs to help with specific symptoms and problems of lupus. Other trials are more focused on testing new drugs that target the immune system specifically and help control the expression of lupus.